What is macular degeneration? Hello, I'm Dr. Martha J, and I'd like to explain a few things about macular degeneration. Number one, it's a leading cause of legal blindness for people over 65. There are two types of macular degeneration, the dry type and the wet type. If you have the dry type, generally you aren't even aware of it unless your doctor tells you so at the time of your regular eye examination. In a patient who has dry macular degeneration, what we see is when we look in the back of the eye, little yellow spots on the retina called drusen. If we see a patient with dry macular degeneration, generally we ask them to incorporate leafy green vegetables into their diet, not to smoke, and to wear sunglasses outside. There are also some vitamin supplements that are recommended that are abbreviated AREDS or AREDS. The wet form of macular degeneration is if blood vessels break through the back of the eye. Those are the patients that are having trouble reading, driving, they may be going to a retina specialist for injections. That's a much more severe form of it. The reason we have patients take the vitamin supplements, if they have the dry version, is to try to prevent the conversion to the wet version. If you do have macular degeneration, another thing we have you do is look at a little grid called an Amsler. It looks like graph paper. And if you see any distortion on that, you want to come in immediately within 24 to 48 hours. If it looks like there's a change that would indicate you've converted to the wet version, then we may refer you to a retina specialist for certain treatments. Nowadays, one of the best treatments for macular degeneration involves injections into the eye. And sometimes when people hear that, they're somewhat fearful. They think, oh, I would never want to do that. But it's really been very effective for improving patients' vision who have this severe form of vision loss. So if you have macular degeneration, the three things to remember are eat leafy green vegetables. If you smoke, definitely quit. Take the vitamin supplements and look at that little grid at least once a month. Thank you very much.